You all are welcome to my YouTube channel. Today I'll be talking about transvaginal ultrasound. I am sure that you might have heard about this type of scan, maybe when you go for your pregnancy scan or when your doctor asks you to go and do a pelvic scan at the ultrasound clinic. So today we are going to be talking extensively about it, and have divided this video into different captions to help answer every question you have concerning the transvaginal ultrasound. So first of all, I am a medical sonographer. I do ultrasound scans, and I am going to be answering every question that you have about the transvaginal ultrasound in this video. The first question is, what is transvaginal ultrasound? What is it used for? The transvaginal ultrasounds help us to visualize your uterus. It is recommended for early pregnancy as well as your gynecological ultrasound that involves checking your uterus, your ovaries, and the surrounding structure. It gives more clarity compared to the abdominal ultrasound. At what point will you be required to do a transvaginal ultrasound? This will depend on the hospital or the clinic. When you go for your pregnancy scan at the early stages, or when you go for your gynecological ultrasound, we will usually start from the abdomen and then talk you into doing a transvaginal ultrasound if we want to visualize certain things. For example, if you go for your early scan and we don't see your baby and we don't even know whether it is an ectopic pregnancy, then you might be required to do a transvaginal ultrasound, unlike in a situation where you go for a scan and we're able to visualize everything from the abdomen. So if you also go for something like follicular tracking, we might want you to do a transvaginal ultrasound because it gives us a lot more visualization of your ovaries so that we can take the measurement of the follicles. Another question that usually comes when we talk about transvaginal ultrasound is it painful? I've done a lot of transvaginal ultrasound for a lot of women, and one thing I can tell you is the number of people who have complained about pain is about 1% of the general population of people that I've done scan for. So the pain threshold is different for everybody. Majority of ladies don't feel pain. What they explain is they feel pressure or a little bit of discomfort, especially when we are moving our probe. But majority of people don't complain pain. However, I understand that there are certain women who have issues with their reproductive system that can cause them pain. Things like vaginismus, ectopic pregnancy, endometriosis, adhesions. These conditions are known to cause pain on a normal day. So if you're going for an ultrasound and you have those conditions, then you might feel pain during your transvaginal ultrasound. Remember to always talk to your sonographer if you are having pain during the procedure. Before we continue on our topic today, I want you to like this video and also subscribe to the channel, because I'll be bringing you a lot more videos concerning your female reproductive health concerns. And if you have any questions concerning female reproduction or fertility in general, I'll be more than happy to take them. So the comment section is actually a very good place for you to leave them. The next thing we are going to be talking about is consent. That is, agreeing for them to do a transvaginal ultrasound for you. So when you walk into the ultrasound clinic, nobody would start doing a transvaginal ultrasound without you giving your consent first. Consent is a big thing when it has to do with a TVS ultrasound. So this consent might be in a written form or a verbal form. Usually we will want you to append your signature and say, yes, you can go ahead and do a transvaginal ultrasound for me, or for you to say, yes, I want this scan to be done. But it is important that whoever is doing your scan for you ask you whether you are ready for that scan, or whether you want just the transabdominal ultrasound to be done for you on the day of your scan. So at what point should you say yes and no to a transvaginal ultrasound? Number one, if you're comfortable to have the scan done, it is your right to say yes or no. In fact, you can just say no in the middle of the investigation. The sonographer will have to agree to whatever you are saying at that point. There is no particular rule as to when you should say yes or no. It is your right to agree or to refuse a transvaginal ultrasound. However, it is important for you to make an informed decision when you are rejecting a transvaginal ultrasound. Sometimes the transvaginal ultrasound might be the only way for us to visualize structures a lot more. Note this: the person doing your scan will not, just because you refused a transvaginal ultrasound and say, oh, I'm not going to try to scan you properly from the tummy. No, we are not going to do that at all. We will try our best to get the clearest picture from the tummy. Only in a situation where we have tried and we are not able to see the structures properly before we can say the patient refused for us to do a transvaginal scan, which would have shown us a lot more clarity than the tummy. Another question you might have about transvaginal ultrasound is infection control. We use one probe for every patient. Everyone who comes into the ultrasound clinic, we use the same probe for them. So how do we keep that ultrasound probe clean so that we don't transfer infection from one patient to another? We clean our probe after every patient. Before we start the scan for you, we will make sure that the probe is cleaned with the manufacturer's cleaning product that is approved. So most hospitals will have a cleaning product that is approved for their type of ultrasound machine. So we use those cleaning products and make sure that we clean the probe thoroughly. Number two thing we do is we cover the probe for each patient. So after doing a scan for one patient, we clean the probe and then we cover it for the next patient so that we don't transfer any form of infection from one patient to another. Our probe cover might be dedicated probe covers, or we can also make use of condoms. In some hospitals, they don't make use of condoms anymore. They make more use of probe covers, and it has shown to protect a lot of patients from hospital-acquired infections as well as transferring infection from one person to another. So you can be rest assured that the probe is clean and ready to go whenever the sonographer is ready to do the scan for you. However, if you're concerned about the cleanliness of the probe, you can ask them to do it right in your presence, and they are going to clean the probe again and cover it. At what point is it suggested not to do the transvaginal ultrasound? Number one, if the patient says no. So if you say no to transvaginal ultrasound, the sonographer will not try to make you do it. So at that point, that is the contraindication for doing a transvaginal ultrasound. Number two, somebody who cannot actually give consent, like a child. So for a child, a transvaginal ultrasound will not be done. Somebody who does not have the mental capacity to say yes or no to a transvaginal ultrasound, or someone who don't understand instructions appropriately. So some people can have certain disabilities that might not allow them to be able to make the right or informed decision about things in life. People like that might need consent given by their family members, and if the family members are not there, then the sonographer is not allowed to do a transvaginal ultrasound for such patients. Other people are maybe language barrier. Before we do a transvaginal ultrasound for you, it is important that you understand the procedure and why we are doing that scan. So if there is a language barrier and the person doing the scan is not able to communicate properly to you, then the person is not supposed to carry on to do the transvaginal ultrasound without you understanding exactly what is going on there. If you have more questions about the transvaginal ultrasound, I am more than happy to answer them. So the comment section is there for you to put your questions, and I will be answering all your questions. I'm still your celebrity sonographer. I'll see you all in my next video.